Um, Welcome, my dear friends. Welcome. I welcome you all. Myself is retired Professor Dr. Rajendra Deshpande, and I think immediately we can start our lecture. But I think first I will better share my screen. So this style is more important. Today's topic regarding the medicine, as you know that myself retired now I am retired. Retired Professor Dr. Rajendra Raghuveer Deshpande is teaching you. This video is regarding the epilepsy. Epilepsy is one of the important disease regarding the convergence. And we will try to understand the causes, symptoms, and the treatment of epilepsy. As you know, I am MD in Ayurvedic medicine and MD in Ayurvedic physiology. Kriya Sharir, that is physiology, and Kaya Chikitsa. My WhatsApp number 922681060. My mail ID is professordeshpande at the rate of gmail.com. I think I should make the screen bigger for better and clear view. So you can always contact me, Professor Deshpande, for any personal health advice based on Ayurvedic Prakriti Parikshan and lifestyle management. What you should eat, what should be your lifestyle. We have the ready-made pro forma to determine your Prakriti, and then I give the lifestyle advice. I also do the palmistry, don't forget it. So anybody wants palmistry, astrology, numerology, I am making the research and I am doing all the consultations. Okay. Then some students are eager to learn privately, private tuitions that I also take. So I request all of you to support by subscribing my YouTube channel. Now, my fans are students, medical students, Ayurvedic, Allopathic, Homeopathic, Naturopathic, Pharmacy and Physiotherapy. Students are there, teachers are there, doctors are there. I am very much thankful to all of them. But this is my request. Whether you practice allopathy, homeopathy, naturopathy, Ayurveda, you must try to find out the root cause of the problem. Whether you are talking about arthritis, whether you are talking about edema all over the body, whether you are talking about fever, you must try to find out the basic cause of the symptom and then you start treating. Don't hit in the bush, don't hit in the dark. So this particular process is called as a, here you can see the cursor, differential diagnosis, and in Ayurveda it is called as Vyadhi Vyavachhed Nidana. Vyadhi Vyavachhed Nidana. So the question will be, write down the Vyadhi Vyavachhedak Nidan of convergence and write down the detailed treatment of epilepsy. Another important principle given by Ayurveda, that when you want to treat any health problem, what is the basic tag? Sanshepataha Kriya Yogo Nidana Parivarjanam. This is the most important management principle that each and every doctor should try to avoid, try to remove, or try to treat the causative factors. We are seeing the medical urgencies in nervous system. My dear friends, on my YouTube, please go and search playlist. In the playlist, you find medicine in GP classes, medicine in GP. And I have already uploaded digestive system problems, respiratory system problems, cardiovascular system problems, and excretory system problems. And I have already started nervous system problems. Here I have already uploaded regarding the vertigo, regarding the syncope, anaphylactic shock because of the injection penicillin, injection B1, that is thiamine, injection interferon, iron injection for anemia. If these injections are given without testing, the patient can die on the table. So anaphylactic shock is a very severe allergic reaction. We have already talked about convulsions. Now today we will talk about, yes, epilepsy. This is the disorder of the brain caused by the abnormal electrical activity characterized by seizures or convulsions. So there are repeated attacks of convulsions with clonic and tonic, clonic, tonic pattern, stiffness, stiffness, convulsions, clonic, tonic. This is very important for epilepsy. And abnormal EEG. For the heart, ECG. For the brain, EEG, electroencephalogram. Electroencephalogram. Gram means graphical record. Tonic, rigidity. Clonic, vibration. Tonic, clonic, tonic, clonic, tonic, clonic. Okay? Dr. Deshpande is in action. Causes 90% it is idiopathic. What is idiopathic? Cause not known. That is called as idiopathic. Sometimes these convulsions, epilepsy, may be secondary to some another disease. There is another disease and then you get the convulsions. General causes of symptomatic or secondary epilepsy. Number one, there may be poisons, poisoning, organophosphorus through the insecticide sprays, insecticide spray. Metabolic causes, kidney failure, urea in the blood, uremia. In the pregnancy, toxic condition, eclampsia. Hypoglycemia in diabetic patients. B6, pyridoxine deficiency. Cerebral causes, less blood supply to the brain, asphyxia, less oxygen. Allergic conditions, sometimes like asthma, there also very rarely, but you can get convulsions. And undetermined causes like teething in the children, high fever, and helminthic worm, worm infections like tapeworm, threadworm, hookworm, roundworm. Roundworms are common. Roundworms are very, very common. Okay. Threadworms around the anal, that is also common. Next. Another further cause list, very big list for the secondary or symptomatic epilepsy. Local causes here in the brain, vascular lesion, blood vessels, cerebral thrombosis, blood clot, stable blood clot, write down, thrombosis, moving blood clot, embolism, stable blood clot, thrombosis, moving blood clot, embolism. Check the blood pressure, hypertensive encephalopathy, trauma, forceps delivery, birth injury, or road accident, head injury. SOL, space, here, this space, inside, space, occupying lesion. SOL, cause of hemiplegia. SOL, related with hemiplegia, cerebral tumors, cerebral abscess, subdural hematoma. Inflammatory causes, inflammation of the brain, encephalitis, inflammations of the meninges, coverings of the brain, meningitis. Congenital causes like tuberous sclerosis, and degenerative causes like presenile dementia is one of the symptoms. Next, idiopathic epilepsy, there are some types, two important: generalized seizures all over the body. Again, subtypes: grand mal epilepsy, petit mal epilepsy. Now we are talking about local epilepsy. That are again three types: temporal lobe, that is psychomotor epilepsy, Jacksonian epilepsy, and grand mal epilepsy with focal onset. My dear friends, I know, but common, grand mal epilepsy. If you try to understand this one only, sufficient. Other causes, mail for the consultant, neurosurgeon, neurophysician. We will study more grand mal epilepsy, idiopathic. Next, what is the treatment? Tablet dilantin, 100 milligram OD once a day or 3 times in a day. Dilantin is a brand name. What is the generic name? Phenytoin sodium, anti-epileptic medicine, allopathic medicine. My dear friends, all Deshpande sir's videos are for educational purpose only. All the time. No self-medication is advised to make awareness in the students, in the doctors, in the teachers. So educational videos. Each and every patient should consult to the family physician, family vaidya, or otherwise Mahuna. We are talking about anti-epileptic medicines. First, phenytoin sodium. Number two, very famous, Gardinal, 60 milligrams. If not controlled by these medicines, in spite of dilantin, you can change. Remove the dilantin, tablet Tegretol, 200 milligram, half TDS, 3 times in a day, or 2 tablets morning, afternoon, evening. If still not result, then change the Gardinal. In spite of Gardinal, tablet Mysoline. Snapshot or make the notes in your notebook. Mysoline 250 milligram, half or 2 HS at the time of sleeping. Caution, caution, caution. My dear friends, some are diseases where you should not compromise with the medicines. You must take it very, very, very regularly. If your doctor, please convince this to the patient. Write down on the subscription. Single day, if you miss the tablet, that can make havoc. If the patient is hypertensive and is not taking medicine 1 or 2 days, he can get a subarachnoid hemorrhage. Write it down. Epilepsy, if he is not taking medicine, very dangerous. He should not miss even in a single day. Second important factor, any allopathic medicines, especially when the patient is on steroids. Why so long tablet? For asthma, for rheumatoid arthritis. If the patient is on anti-tuberculous AKT, anti-cox treatment. If he is on hypertensive, anti-hypertensive medicine. If the patient is taking medicine for diabetes mellitus, and the patient is going to Ayurvedic doctor, patient is going to homeopathic doctor, patient is going to naturopathic doctor. My kind request to all community, please, please don't play with the life of the patient. Whatever you practice, go in a scientific manner. Don't stop any medicine abruptly. That can give very serious problems. So, this epileptic drug should not be stopped all of a sudden, rebound, and patient may suffer from serious status epilepticus. Anti-epileptic drugs, even if the convulsions are controlled, this should be continued for minimum 5 years after the last fit or convulsions, and slowly tapered off. Like for example, 2 TDS, 1 TDS, 1 BD, 1 OD, then stop. This is called as tapering. Many students don't know what is tapering of the medicines. Steroids, tapering. Anti-epileptic, tapering. Anti-hypertensive, tapering. Anti-diabetic, tapering. Yes. Avoid. In addition to the medicines, the doctor should advise to the relatives and the patients. Epileptic patient should avoid swimming, should avoid driving the vehicles like car, scooter. No, no, no. Climbing upstairs without any help. Work near the moving machinery, like in a mechanical work. Standing in the train or the bus door, near the door. Working near the furnaces, fire. This should not be allowed. because that can cause a havoc in children. To minimize the neurological deterioration, start tablet Tegretol, carbamazepine in spite of tablet dilantin. In children, no dilantin, Tegretol. No dilantin, Tegretol. Children. Next. Possibility, explain, counseling to the patient and relative that recurrence can take place. During the fits, convulsions, support the patient and gently lie the patient on the ground. Then put a spoon here in between the teeth or handkerchief between the teeth and wait for convulsion. Automatic will be stopped. Epileptic fits are automatically stopped. Don't worry. Now, next, petit mal epilepsy. The medicines are tablet valparin, sodium valproate, 200 milligram, one or two tablets 3 times in a day. Or in the children, syrup, ethosuximide, 250 milligram, that is 1 TSF, OD, only once. Capsule, triadione, trimethadione, 300 milligram, one or two tablets, morning, afternoon, evening. We are talking petit mal epilepsy. Gardinal, 15 to 60 milligram at night while going to the bed. Snapshot, if you want to write down these medicines, yes, you learn these medicines. Now, another thing, totally different. Epilepsy is a physical problem. Hysterical fit is a psychological problem. The question is always asked to the students in the written examination and in the oral. What is the difference in epilepsy and hysteria? Epilepsy and hysteria. Apasmar in Ayurveda. Unmad in Ayurveda. Apasmar, physical problem. Unmad, hysteria, psychological, manasik, mental problem. Okay. So hysterical fits, convulsions are diagnosed. If these convulsions are not typical, tonic, clonic, no. In hysteria, no. Tonic, rigidity, clonic, tonic, clonic. This pattern is not in the hysteria. Patient will never hurt himself. I am sorry, gross printing mistake. I will correct it. Hurt, I am sorry. Patient never get hurt, H-U-R-T, and not hurt. I am sorry. Save. I am making the saving this, okay? Because he will not, hysterical, psychological problem, he will not fall all of a sudden. He knows where I am, how I should fall, because it is show off, public show off. Hysteria is a public show off. So never hurt himself or herself. No history of injury, no history of tongue bite, during the convulsions. More dramatic, and convulsions occur always in presence of the people. Public show, not when he is alone, not in the sleeping. So all causes of convulsions should be ruled out before labeling patient, stamping patient. Hey, तुमचं मानसिक है. It's your psychological. No. You must thoroughly check all the possibilities and then say this is hysterical. Treatment for hysterical fits, Largactil 50 milligram iron stat. This is antipsychotic. Largactil. Then tablet Largactil 50 milligram BD or 2 times in a day or TDS for minimum 15 days. And please refer these psychological patients to the psychiatrist. Simple thing. Now, Ayurvedic perspective. Hysteria is Unmad, epilepsy is Apasmar. All the references, Ayurvedic students, you have to study this Sushruta Samhita because definition is given in Sushrut Uttarasthan 61/3. Charaka Samhita Nidanasthan 8. And in the Tika there is more description. Madhave Nidana Srishtaha. Madhava Nidan is the text. very useful for diagnosis. Apasmar chapter is there. Hetu, causes of Apasmar epilepsy are given in Sushruta Samhita Uttarasthan, 61st chapter, 4th number shlok. Samprapti, pathogenesis of epilepsy, Ayurvedic. Now we are talking about Ayurvedic. Is given in Madhava Nidan Apasmar chapter. Also, Charaka Samhita Nidanasthan, chapter number 8, and also in Harita Samhita. Harita Samhita, third section and 18th number shlok. Purvarupa, prodromal symptoms are given in Madhava Nidan Apasmar chapter epilepsy. Further references. Samanya Lakshana, common features. Clinical features are mentioned by Harita Samhita. Tritiya Khanda, Tritiya section, 18th. Charaka Samhita Chikitsa Sthan, chapter number 10, shlok number 4 to 6. Ashtanga Sangraha Uttar Sthan, chapter number 10, shlok number 99. Vishesha Lakshana, specific symptoms according to the dosage given in Madhava Nidan Apasmar chapter 3 to 5. Sadhya Sadhyatva, prognosis. Charaka Chikitsa Sthan, chapter 10. Chikitsa, management of the Apasmar, Charak Chikitsa Sthan, chapter number 10. Interested people should search for these original references and try to get the original knowledge. Okay? Samprapti, dosha prakopaka hetu, vat pitta kapha prakopita. Then there are psychological things like chinta, anxiety, shok, depression. So all these things they cause vata dosha prakopa, because vata dosha is concerned with the nervous system. Vata dosha is a bioenergy responsible for all type of the movements, all types of conduction, neurological conduction especially. Then next is the sthana samshraya in hridaya. Here hridaya is not only this heart but related with your mastishka or the brain, where you have the limbic system. Basically here we are concerned with the nervous system or the brain. Okay. So again I think there must be printing mistake here. Buddhi place. What I should write? Yes, I will correct. No problem, my dear friends. We are friends. We are friends. Huh? So everything you will accept that Dr. Deshpande is doing something genuinely. Huh? So personally he is doing all the things. So here and there it can happen. Okay. Okay. So Rudaya Buddhi place means brain, indicating brain. Manovah Srotas Avarodh. Again, Manovah Srotas is concerned with the brain. There may be obstruction in the electrical current. Obstruction in the electrical current, that is Srotavarodh. Then naturally Indriya Vikruti. Ayurveda says sensory and motor organs. Jnanendriya and Karmendriya. Shrotra, Tvak, Chakshu, Rasana, Grahana, Jnanendriya. Vak, Pani, Pad, Payu, Upastha, Karmendriya, motor organs. Okay. Then what is that? Saujñavah, Stroto Avarodh. Srotas means channels according to Ayurveda. Then Apasmar Vega. Vega is an acute phase of convergence, Vegavastha. And whenever in between two episodes, in between two exacerbations, in between period it is called as remission. Relapse, remission. Relapse, remission. Relapse, Vegavastha. Remission, Avegavastha. Ayurveda. Relapse, Vegavastha. Avegavastha, remissions. Smruti Nash will be one of the complaints. Temporarily loss of memory. Patient don't remember that he has this particular convulsions. Now, Samprapti. Vata Chalaguna. Chalaguna is disturbed. Chala means movement. Nerve conduction has been disturbed. Majja Dhatu Vikruti. Dushya. What is the Dushya? Majja Dhatu, nervous tissue. Vataj Apasmar, tonic clonic seizures. Pittaj Apasmar, temporal seizures. Kafaj Apasmar, akinetic seizures. types according to Ayurveda: Vataja Apasmar, Pittaja Apasmar, Kaphaja Apasmar, and Sannipatik. Chikitsa, two things: Vegavastha and Avegavastha. In Vegavastha, to control these seizures, convulsions, Trasana Chikitsa, stimulation, sprinkling of the cold water on the face, Tikshna Nasya, by experienced Vaidya only, not by anybody. Very strong nasal drops, onion juice, then powder, Vacha, calamus powder, or Vacha nasal drops. Pradhamanasya is sprinkling of the fine powder in the nose, but that should not be tried by anybody. It is a job of very, very experienced, expert, and skilled Vaidya, not of anybody else. Then Tikshna Anjana. In these days, these particular treatments are not followed very rigorously or vigorously, but it is a textual references. This is a research question. This is a research question. Shwasa Kuthar, fine, very, very fine churna of the powder with honey, and on the eyes it has the application. But this is not practiced routinely. This is for only research purpose. Dhupana chikitsa, yes, that is practiced. Gukulu powder or vacha, calamus or asafoetida or mustard, all these powders are ignited and fumes is given to the post-epileptic phase. Okay. After fits, rest is important because we have to control the vata dosha. Lie the patient. Patient will automatically go to sleep. After getting up from the sleep, he has to take the warm shower. Then food, light, liquid, and warm. These qualities are important. Light, liquid, and warm. Well, freshly cooked food, sattvic food should be taken. No rajasic, no tamasic food should be taken by epileptic patients. Apasmar avegavastha, remission period, relapse and remission. Shodhana as per the dosha type. In Kaphaja patients, Kaphaja type of symptoms, Vamana is advised, therapeutic vomiting with Madanaphala, Yashti Madhu and Vacha powder with honey. And finally, Yashti Madhu decoction is also given. In Pittaja type of the patients, Pittaja type of the clinical features, Virechana, therapeutic purgation is given with Aragvadhu, Bahava, Haritaki, Amalaki, Draksha, Nishottar. You can have the different preparations. Prepare a decoction or ready-made tablets are also given, etc. etc. These all the purificatory processes, detoxification to reduce the frequency of the attacks. Reduce the frequency of the attack, number one, and to reduce the intensity of the attack. Intensity of the attack. So brain is becoming stronger and stronger and stronger by Ayurvedic supplementary medicines. I hope you are understanding the role of Ayurveda. In Vataja type of the person, Vataja type of the Apasmar, Dashamula Kvath decoction and Sahachara Taila or oil is given alternate as a Niruh and Anuvasana Basti. Basti is a medicated enema. Niruha is also called as the Asthapana Basti, which is given with decoction and oil. And Anuvasana is called Snehana Basti. Only oil is used for the medication, Basti, medicated enema. Now, Rasayana Chikitsa, Apunarbhava. Number one, for the brain, medicated ghee is the best. Buddhi Vardhaka. Dhi, Dhruti, Smruti, Vardhaka. Dhi is, what is Dhi? Correct and wrong, decision capacity. Correct and wrong, Dhi. Dhruti, courage, mental courage. And Smruti, memory. Siddha Ghrita, medicated ghee with Vacha, Kushmand, Ashwagandha, Withania somnifera, Jatamansi, Nordus Stachys Jatamansi, Brahmi, Centella sativa. These all the plants are cooked in the ghee. Then the ready-made available, Panchagavya Ghrita. Panchagavya Ghrita for epileptic patients. Brahmi Ghrita for epileptic patients. Different medicines are used by the Ayurvedic Vaidyas. Mahavata Vidvamsa. This is the name of the tablet. Smruti Sagar Rasa. Bhoot Bhairava Rasa. Samira Pannak. Suta Shekhar. Brahmi Prash Jam. Medhamrut. Prashama tablet. Prashama syrup. Ayurved Rasashala Pune. Bruhat Vat Chintamani Ras. Very costly medicine, but Sukshma medicines are also cheap. For any difficulty, my Huna, you mail me, Dr. Deshpande. Single herbs, single herbal tablet, Ghanavati, Chaitanya Pharmaceuticals, Maharashtra State, Brahmi Ghanavati, Vacha Ghanavati, Jatamasi, Pippali, Tulas, Dhatur, Trifala, Sarpagandha, Ashwagandha, Khurasani Ova. And which are the bhasmas? Metallic oxides, Abhraka Bhasma, Raupya Bhasma, and Suvarna Bhasma are best to control the epileptic attacks. Then Vriddha Vaidya Parampara, very different medicines. Just I am sharing the experience. Fresh leaf of pimple, apply the ghee to the particular leaf. Put freshly cooked warm rice on it. Keep another leaf, pipal leaf on the top with again ghee application. Keep some pressure, heavy things on it, and then after some hour or two, eat that rice after 10 minutes. But you have to do this particular procedure for a longer duration, 6 months, 1 year, every day. This medicated warm rice with pipal, sanskar, that is, some Vaidyas have proved that that can reduce the epileptic attacks, duration, frequency. Pimple leaf is not mentioned in any Charaka, Sushruta and Bhagbata, but my Guru, Vaidya Yagodoshi sir from Pune, Vaidya Khadiwale Vaidya, famous from Pune, they have taught me this particular treatment part. They have found very useful in epileptic patient and also not only epilepsy, other manasa vyadhi or psychological problems. Yes, this is very interesting part has been covered. Epilepsy, end of the topic. So always management should be ahar, vihar, aushadhi, diet advice, lifestyle advice, and medicines. Disclaimer: these medicines are mentioned only for educational purpose. Self-medication should be avoided. If anybody does that mistake, his own responsibility. Dr. Deshpande will not be responsible. Okay? Thank you very much. My dear friends, I hope you like my all these videos. Please share it with all your friends to the WhatsApp. Make the like for it. Write me some feedback that gives me energy. Yes, I request you. And then don't forget to ask your friends on behalf of me as a health ambassador. Please subscribe Professor Deshpande's YouTube channel. Thank you very much. I wish everybody of you happy, healthy, and long life. Now I am stopping this video. All the best. Take care. Bye bye. Bye bye. Bye.